Sometimes we overlook the challenges faced by those without regular access to health care. Jenny Kahn shares her insights as a nurse practitioner and also as an advocate for the Native American communities. In her role at the Native Healthcare Center, she helps bridge the gap in healthcare access for those who have moved off tribal lands. During this conversation, you'll learn how Jenny and her team are making strides in screening and awareness for breast cancer among Native Americans and others. When you subscribe to our show, you help us grow. Someone you know may need to hear this story, so please share with your family and friends and consider supporting our mission at therose.org. Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. Jenny, thank you so much for being with us today. I'm excited to hear everything that you're going to tell us, and I know that you have an important message for some of our underserved populations. So I want you to start first, though, with telling us a little bit about yourself.
Well, it's an honor to be here today. Thank you so much for having me. My name is Jenny Kahn, Native American. I'm with the Tunica Biloxi tribe of Louisiana. That is my ancestry. Our tribe is in Louisiana, so it's not here, but I was raised partially on tribal land, so I'm very familiar with, Native American process and how health disparities can kind of affect our population. Mm-hmm. But as far as me, I'm a nurse practitioner by trade. I love working with people. I think it's my calling. I'm always volunteering, always helping out. Sometimes my family says I do too much, or like when my kids were little, I have two daughters. They're one's in college right now. She's going to PA school, so she'll be done soon, and maybe she'll come help me. Probably not. You know how the teenagers are and the college students. And I have another daughter who's an engineer, and she works in Dallas. She's a systems aerospace engineer. She can't talk too much about it, so I don't ask her questions or allowed to ask her questions about it because it's top secret. But anyway, I'm married, happily married, and I've been married for a very long time. I live here in Houston, and I enjoy what I do. I help our community. I really enjoy working with the public.
So what got you interested in healthcare?
I think it's a calling way back. So when I was 19, I became an LVN. So I kind of did all the process of going up the ladder. I went from LVN to RN and got extra degrees and just kept giving myself knowledge. Mm-hmm. I finished with my terminal degree. I don't think I'll be going back to school anymore because I've got my doctorate degree in nursing. I think I'm stopping because I'm getting up there in age. So I I don't want to do no more school.
That's enough, yes.
That's enough. I'll take a class here and there, but that's enough. So healthcare has always been a part of our family, and knowing about the health disparities that our community, the Native Americans, they're interchangeable. Native Americans, American Indians, it's however you want to phrase it. We're the same indigenous population. We come from a tribe, a culture of people with certain values and traditions. So that is where I'm founded from. Our tribe itself is a mixture of different tribes because when we migrated, we became Tunica and Biloxi. So we combined way back then. I don't know when, so don't ask me that date. So I've been in healthcare a long time. I think it's just my mom is a nurse, my aunt is a nurse,
this was
my
a family
So
tradition,
it's kind of family thing.
Yeah.
And, one of my daughters, the other one said, no, Mom, I'm not doing that. I can't do that.
So now, I know you're with the Native Healthcare Center.
Yes.
And I know you care for all different kinds of folks. Is this a full-time job for you, or are you there? Tell us about the center, how often it's open, what kind of services, that kind of thing.
Well, Native Healthcare Center is located in Houston. We're off 610 in Tacoma area. So we started off as 3 Native Americans that started a nonprofit. I helped found it along with 2 other Native American females. And our goal was to help our community because living on tribal lands is different than you living in the urban cities. So when you live on tribal lands, you have access to health care, social services, and so forth because you're in the service area. But once you move off, and a lot of people move into the urban areas, one for education, jobs to help support their families, and other things. So at that point in time, you lose those services. So when you move into another area, one of our biggest health disparities is how do we connect now when we don't have all those things that we used to have? How do we navigate the health system to get the services that we're so used to having on tribal lands? And now, they don't get everything, but it is funded by Indian Health Services. So Native Healthcare Center was founded by that thought concept for us to kind of connect that issue or problem per se, where we could help our people navigate the healthcare system.
So you're more than a bridge.
More than a bridge, yes.
Right. You're actually providing services.
Yes. So Native Healthcare Center, we're all about screening and awareness. So a lot of our programs, our biggest program is breast cancer and cervical screening. So we work in partnership with a couple different organizations, and they help support and partner with us to help provide those services. So it's important for our community, Native Americans, to access the services. Not only do we service them, but we service other underserved and underpopulated areas.
So basically anyone's welcome.
Yes, anyone's welcome with those programs. And we offer screening services, breast cancer screening services to help them get the exam, the mammogram, as well as the pap smears, the cervical screenings, and kind of address awareness and screening and help those individuals get detected or identified before it's too late.
Right. Is it easy to talk about breast cancer or cervical cancer within your community, or do you have to do a whole lot of working up awareness programs to get to it?
I think it is. It's not so much that it's a touchy or offensive or anything. It's just awareness, understanding, because we have to look at the age that we're trying to get screened and how they are lived, how they've lived.
That's true.
Lived in a time period where these type of cancers were not so prominent, and screening services and education was not there. Right. We knew we had to go in to see the doctor, but I can't remember living on tribal lands as a child when anybody said, we got to go to the doctor for your 6-month checkup or your yearly annual exam. It just wasn't part of the conversation as what it is now. So it's very important that we make our community aware of the importance of getting screened early.
When did the center start?
We started 2 years ago.
So it's still new.
It's still new. We're hitting our 3 years in a few weeks. We started with little to nothing, got out there, boots on the ground, they said, and it's actually a song now, Boots on the Ground or Fan, whatever it's called. So we've been outreaching a lot of organizations, trying to find support, and we finally have people that are willing to work with us, and we're really appreciative of it.
Oh, well, the service you're doing is so important.
It is very important.
You also are on the, what was it, the Tribal Elders Council?
Yes.
And tell us the other thing you do in Texas, over a coalition. Okay. So explain. I didn't even know. I
have my hand in everything. I'm a volunteer of all trades, they call me.
Okay.
So the Texas Tribal Council that we have is consistent of our elders in the community. So we have, in my tribe alone, at least 90 members living in the surrounding Houston area, some in Beaumont, what have you. And they are not connected to a lot of resources they have. So either they don't meet the Medicare requirement or they not have the access that they need. So we try to help them. So that was the whole part of the Texas Elders Council, is kind of outreach and get them back to our community. The Texas Coalition Chapter, now that's a whole big other thing. So that's in partnership with the American Indian Cancer Foundation. So I'm the chairwoman for that process, and the whole process for that is educating our Native American communities that we have in Texas, Oklahoma, and Louisiana, and how they can take their existing program and improve their awareness and screening programs.
Wow, that's pretty far-reaching.
Yeah, it is pretty far-reaching. So we meet pretty much once a month. We have probably several, it's virtual, so a lot of people will join us. We have people that focus, and it's not just for breast cancer screening. It's about the 4 major cancers for Native Americans in our coalition, which is breast cancer, cervical cancer, lung cancer, and tobacco screening. So the coalition is encased in all of that. So we meet, we have speakers that come, we provide resources, support. We have campaigns every other month to support the awareness. It's a lot of stuff to do, but we manage it. We have lots of support and lots of people that are a part of the program now.
And has that been around for very long?
So the coalition part is like I mentioned, with the American Indian Cancer Foundation, and I was asked to help them run that coalition because I'm in Texas and I help with the other stuff. So I believe that's been around probably about 2 to 3 years. It just really hasn't got off the ground until now.
What's been the difference, do you think?
I think the difference is knowing that we have a large population here that is not being identified, because the largest Native American or American Indian healthcare center is in Fort Worth, Arlington, Texas. There's a Native American tribes that were within 2 hours distance, but the largest fully functional, multifaceted healthcare center is in Arlington, the Fort Worth area.
Okay. So you have not had one of our mobile's mammography screening days yet?
No.
But you're about to.
I'm about to. I'm about to get that experience, and I can't wait.
So how are you going to sign people up? How are you going to make them aware that it's coming? Are we going to the center? Okay.
Yes. So help us out if we need to do something different, because y'all are the experts in this. So, of course, we have many different social media platforms. That seems to be the thing now, and everybody's on social media. It doesn't matter if you're 2 years of age or you're 90 years of age. Everybody's on some platform these days.
That's true.
So the message, we have other programs. We do have a large mental health program that we do for our youth, for Native Americans. It's just sidebar, and that's from, so we provide mental health services from ages 13 through 24. That is grant funded. It's not directly under my department, but it is run by Miss Morales, and she's amazing. But we have that also for our community. But as far as the mammogram, we're going to pretty much, here we go again, boots on the ground. We have lots of platforms that we're a part of as far as our community. We're in all these different communities. There's like 5 or 6 different communities near our location, and we network throughout the system there, the city, because we have lots of partnerships now, some collaborations with different organizations, so they support us. Mainly they come out through our community health events, which we host every 3rd Saturday of the month, and we have probably 20 different vendors come out, and they share their services, whether they be for, I don't want to sound morbid, but, funeral services. You need that.
Yes.
Health insurance. If you can't navigate, or if it's something that we don't do, then maybe they could change up their health insurance. We have the Harris County comes out. We have the Office of Aging that comes out, provides resources to the elders, things that we're not able to do for them.
Right.
So we try to encompass that at least once a month. Okay, well, the Offices of Aging is here, and they can help you with a hearing aid. That's something we can't do.
Right.
So we try to help them in all facets of their disparities that they have.
So do you think you're going to need to do a lot more awareness about the importance of a mammogram?
I think so.
Within your
So.
community? Yeah.
I think so. A lot of people talk, I need to go get it done. I need to get it done. And I can hear that same thing from the same person probably a year now. And I'm like, maybe you should have done that 6 months ago.
But now I'm going to tell you, our surveys that we do with our ladies who have been screened on the mobile, something like 67% or higher in some communities say they wouldn't have got it if we hadn't brought the mobile there. And I just think that's kind of universal. It's not an easy thing to make an appointment for. You put it off as long as you can. It's just one of those things that women
Well, I think the thing is now with most people, because of all the social media, it's all about convenience care.
It is, yeah.
I'd like to wake up and just go see my doctor and walk in and be done with it. Oh, I feel like I need to go get a mammogram today.
Doesn't happen.
You have a
right.
low percentage of people used to make appointments. Now they really focus on convenience care. It's like, I want to go in and get everything done today. I feel like I want to go get my mammogram today. So I think that's probably true, what you're saying about the mammogram bus.
So, but it's an important thing for you to remember as you're doing your publicity or, signing people up and that kind of thing, because it isn't, it's just not something
that they can
we
wake
often
up.
prioritize.
Yeah,
It's so true. So I'm delighted we're going to be there, and I think it's going to, just having the mobile there is going to be a big statement, because it's going to say, it's here. You don't have to wait anymore.
Yeah, I think so too. I think it's going to be a really good success, and I hope that we can get as many people get their mammogram that day.
So when you're thinking about the different diseases that you're doing a lot of awareness on, what kind of myths are you having to really overcome?
Well, I would think the only myth is a lot of people say, well, nobody in my family has that, so I don't think I'm going to have that. And that's not necessarily true anymore.
Oh, it's not.
Things have changed in our society, and, we can blame it on, like, different things like our food supply, our food chains, and our medications and how things are now. It's different, I always refer it back to my daughters. When I was a young lady, growing up as a teenager, I was a scrawny-looking thing. Now they look like full-grown women at 12 or 14 years of age.
That's true.
So I think there's different things that we have to consider as far as, people saying that this would happen in their family. Like, my family, my aunt had colon cancer, and she never, now this is coming from my cousin, so, I don't know the whole story, that she didn't get treatment or she didn't know, and it wasn't long after she really went in and she passed on. So it's in everybody's family one way or the other. It's just
it's either there's no family history or they have no symptoms, which is the whole point of screening.
Yes.
To find it before there is a symptom. And what's another one? I feel good. I can't possibly have anything wrong with me.
Yeah.
There's a saying in the breast cancer world that this disease happens to the healthiest people. I mean, it's not anything you did. It just happens. So.
It just happens. Anything can happen to anybody. As my mom said, we're never promised another minute. So we take advantage of what we have right now. And I think a lot of people, you have to understand how I've lived without anything. I come from a family of 10 siblings. And we had a single mom. Our fathers passed away at a young age, so she had to work the night. So sometimes it helps to have lived in those situations to understand how other people are lived, because other people that are third parties can only imagine how they've lived. Right. So I think that helps me a lot understand that, I remember where I come from, so I remember how it's important to help people. It's different now.
So I hear you being an advocate for health, but you're also an advocate for the Native Americans. You're and the underserved. I can see all three of those working.
Yes.
In your approach to what you're doing.
I understand what it is not to have that in your lives. And I remember the struggles that my mom went through trying to access care for all of us and so forth. So you kind of understand. It's not that somebody can't understand or have empathy towards something, but
it's different.
It's different in its own little way.
Where are you in that 10 siblings? Or
I'm third from the last.
Oh, well.
I'm like a middle child, but not really a middle child.
Oh, my goodness. So lots and lots of family.
Yeah, definitely. Lots of nephews and nieces and lots of siblings.
Yes. So what do you think is the most important message that you're trying to get over to the patients that come through your center?
I think the most important message is just be aware. be aware of your health. Not everybody understands everything because health, the education, the understanding of terminology, the words, or sometimes they'll come when it's, oh, I have a lump in my breast. It could be nothing, could be just a boil or abscess, but it could lead to something else. And a lot of times they'll take care of just what that problem is, but that may be an indicator something else is going on.
That's so true.
And it's really education, trying to get them to understand. And we have to understand that each person is different on their own level. When you speak to them, when you educate them and you make them aware, you have to focus on who they are. You can't treat everybody the same.
Oh, that is so true. You have to meet them.
Meet them at their place.
Right.
I won't say level. Meet them at their place. It's a better way.
That's an excellent way of putting it.
Yeah.
And and what we hear a lot is from mothers is they wouldn't let their child not go to the doctor, but when it comes to themselves, it's like, oh, well, I'll feel better tomorrow, or whatever. I'll do it tomorrow. I'll do it another time.
I have to tell you about my mom, what she did. So that's a good thing. So she didn't know any better. So I was at school, and I think I was playing this game, Jump the River, and I jumped the rivers too, like jump ropes. We're just playing a game. I jumped. Everybody jumped on me. And I didn't think nothing of it. I was crying. I think I was in second grade. And then my chest was hurting. And I would tell my mom, my chest is hurting. She put Vicks vapor up. They all
lived on Vicks.
All remedy for everything. Couldn't to find out I had broken my sternum all the way up.
Oh, no.
She said, I'm sorry. That didn't work for you. I'm like, as they're trying to pull me back together and stuff, I'm like, she's going into surgery. She broke her clavicle, a little bit part of the sternum. I said, that's major surgery. So she said, I'm sorry. I thought you were just got a cold. Old remedies that, back in the day.
Oh, I remember those. I tell you, we put them on our feet. We put it on our chest.
I still use it to today.
Under your nose.
My favorite thing.
All those things, yes. And in spite of all, sometimes just believing something will help you is sometimes the best, not in this case, but sometimes the best case or the best medicine of all. If you think you're going to get better because of something. Yeah,
something like, the remedies are still there. Everybody, every ethnicity, has their own cultural traditions. Certain things work, but then, a little bit more helps.
So is there a certain tradition in the Native Americans in your tribe that you remember when it came to health, besides the Vicks?
Oh, well, that Vicks was everywhere. Back in the day, I remember when I was small. It's right now, there's not a whole lot because as years pass, traditions and the elders, if they're not there, they would mix up some little paste or something. I don't know all the ingredients in it, but, it was a little paste they would put on and stuff and, steaming and, putting hot rocks and stuff. It's kind of like they're steaming the stuff out of you. So some things that I remember, not a whole lot of stuff, but,
Well, it is so interesting to know that sometimes those old remedies turned out to be based on something that was very valuable and actually worked.
Yeah.
And I just, what we used to call old wives' tales, how they, that really does, that can help.
It can help. I still believe if we can make it rain and stuff like that.
Hey,
I think we did too much last year.
Yes, you can pull it back now.
Yeah, we can pull it back now.
Yes. Well, what else would you want us to know about Native Americans' health? The American Indian Cancer Foundation.
Yes, the American Indian Cancer Foundation. They are the heart, and they are a great resource as well. They are been with us since day one, helping us get, they understand the importance of it, how we get it out into the community and how some areas are not, they're neglected or they're not approached. So I think that's the most important thing, is just making people aware and the importance of screening.
Oh, yes.
Yeah.
Yes.
Definitely.
And with those diseases that you're covering, though, they all have a different type of screening.
Yeah, breast cancer is the second leading cause of cancer in the American Indian Native American population. 1 out of 8. There, it's a high prevalence in our community, and that's why it's so important that we get the word out, get screened.
Yes.
I don't know what's changed. Maybe it was always there, and we never knew about it, and people passed on just
and
knowing
we didn't
they had
talk
something.
about it
we
being,
didn't talk about a
no,
lot of things. I don't remember when I was younger talking about a lot of stuff. You go to school, you come home, and now I don't remember any of those things that we can talk about a little bit more freely now.
And that's so important. Well, what is some other advice that you would give, or you find yourself giving every day in the clinic, in the center?
I think the most important part is just, reminding them of keeping their appointments, scheduling their appointments, and just connecting with us if they have a question. Don't be afraid to ask the question. I know when I went to a doctor's office, I was a little apprehensive of asking stuff. Now I just ask whatever I need to ask, and maybe too many things.
Well,
I think it's because, of age. But the younger generation, we're seeing more younger generations with risk factors and actually getting colon cancer, breast cancer. Things are changing, so maybe those guidelines may change a little bit later on too.
that would be wonderful.
Yeah, that would help us connect with some people that really need it and get the support they need.
But I think you made a really important thing. Don't hesitate making that appointment, but keeping it.
Yes.
Yes, it's too easy to, I don't want to say forget on purpose, but it's too easy to just skip it.
Well, that's true. And we have the mammogram buses coming out 3 times this year, so we'll probably have some people sign up. But the part will be them keeping it. So that will be the patient navigators' fulfilling job there, is to keep in contact with them. Because, we all make appointments now, and then maybe 3 months down the road, things happen.
Right, and they do.
Yeah, of course.
Well, thank you so much for being a part of this podcast.
You.
And how do we find the Native Healthcare Center?
Native Healthcare Center is in Houston, 10485 Northwest Freeway, which is 610 in Tacoma. We're easy access from the Galleria, downtown, the Cypress area, more than 15, 20 minutes.
Bus lines?
Bus lines are right there within the city limits. They can reach us by phone or text.
Okay.
Which is important because everybody likes to text and nobody likes to talk to each other anymore. And that's at 713-309-6417.
And we'll put all that in the show notes, and hopefully we'll have a great, great mobile day with your center. Thank you again for being with us.
No problem. Thank y'all for having us.
Thank you for joining us today on Let's Talk About Your Breasts. This podcast is produced by Speak Podcasting and brought to you by The Rose. Visit therose.org to learn more about our organization. Subscribe to our podcast, share episodes with friends, and join the conversation on social media using hashtag Let's Talk About Your Breasts. We welcome your feedback and suggestions. Consider supporting The Rose. Your gift can make the difference to a person in need. And remember, self-care is not selfish. It's essential.